Hello everyone. In this video, I will talk about Ewing sarcoma. Now, in this video, all of the important points I have highlighted in the pink color. So, whatever points that you see during this video in the pink color are extremely important to be remembered, and they definitely have to be included in your revision or in a revision for your competitive exams, or if you are preparing for a theory exam. These points definitely have to be included, so watch out for the important points. So, Ewing sarcoma is a malignant bone tumor, and the most common age group that it is seen in is 10 to 20 years of age, which means the second decade of life. Now, there are 2 points over here, which says the first one says the most common age group it is seen in is 10 to 20 years of age or the second decade, and the most common bone tumor seen in the first decade is Ewing sarcoma. What is the difference between these 2 points? See, most common age group that is affected by Ewing sarcoma is the second decade, right? But if somebody in the first decade is diagnosed with a bone tumor, it is most likely to be an Ewing sarcoma. That is the difference between 2 points. The most common age group will remain the second decade, so it will happen between 10 to 20 years. But if a tumor is seen in the first decade, it is most likely to be an Ewing sarcoma. If we look at the location, now this is a diaphyseal tumor. It is located in the diaphysis part of the bone, and the sites where it is seen, or the bones where it is seen, are the femur, most commonly the femur. Other than that, you can have the tibia, pelvis, and the calcaneum bone. In clinical features, males are more affected than females. So there will be a history of a male child in the age range of 10 to 20 years. Okay, and the child will complain of swelling, pain in the limb, swelling in the limb, and there might be a history of trauma, and there will also be a history of fever. So, because the child has a fever, this condition gets mistaken for an infection when it is actually a bone tumor. So, the child will experience swelling, pain, fever, and all the signs of inflammation might also be seen, which is why it gets mistaken for an infection. If we do an examination, there is a swelling in the diaphyseal region or the middle of the bone. See, the diaphysis is in the middle of the bone. So, if we look at this bone over here, this forearm bone, there is a tumor in the middle of the bone. It's not on any of the ends, it's in the middle. So, that is how you know that it is a diaphyseal tumor. Next, if we look at the pathology, if we look at the gross appearance of the tumor, it is a grayish white colored tumor. If you look at here, it's a grayish white colored tumor. Now, biopsy is a very important investigation in Ewing sarcoma, and biopsy reveals that it is a small round blue cell tumor, which means that the tumor will be comprised of small round blue cells. You can see over here, all these cells, they look really small and round and blue in color. So this is one of the tumors which looks like a small round blue cell tumor. And there is also a pseudo rosette formation. Now, pseudo rosette means that there is a central clearing surrounded by tumor cells, as you can see over here. The central part will be cleared, and the surrounding part will have tumor cells, and this entire thing is called a pseudo rosette. So, that is what we see in an Ewing sarcoma. If you look at the X ray, the periosteal reaction that we see is an onion peel or lamellated appearance. This is how it looks like. This is the periosteal reaction which happens to limit the spread of the bone. Okay, and this, in case of Ewing sarcoma, it looks like an onion peel or lamellated appearance, meaning that it will appear as if the tumor has multiple layers. Now, this is a pass positive diastase resistant tumor. Pass positive diastase resistant tumor, and the specific marker of this tumor is CD99 or MIC2. These are the specific markers. If we do a karyotyping, The genetic alterations that we see are a translocation 1122 or a translocation 722, where translocation 1122 is the most common and the most important one that you have to remember. Now, if you look at the treatment, it's a highly radiosensitive tumor. Ewing sarcoma is very radiosensitive, but radiotherapy is not the primary line of treatment. Treatment is still done by chemotherapy and limb salvage or resection surgery. Okay, so we give chemotherapy and we do a limb salvage surgery or a resection of the tumor. Radiation may or may not be given as adjuvant. So, even though it is radiosensitive, radiation may or may not be given. Now, if you look at the prognosis, there is a high chance for recurrence for this tumor, and this tumor overall has a very poor prognosis. There is bone to bone secondaries may be present, which means that if it appears in one bone, it could spread to some other bone as a secondary. And 5 year survival with chemotherapy is approximately 30 to 40%. Now, there are some factors that make Ewing sarcoma a poor prognosis. So, what are those factors? What are the poor prognostic factors if metastasis is present? If it's not localized, if a metastasis is present, then it becomes a poor prognostic factor. Male gender is also a poor prognostic factor for Ewing sarcoma. Presence of fever and anemia, raised ESR, all of these signs of inflammation, they are poor prognosis. They indicate poor prognosis. If it happens in somebody with age more than 12 years, that is a poor prognosis. If the WBC counts are raised, if even after giving chemotherapy the tumor is not getting small or it's not getting resolved, then which means resistant to chemotherapy, then that is also a poor prognosis. Relapse is also considered poor prognosis. And finally, if there's a big size lesion, then that is also a poor prognostic factor. Now remember, with this video, I have noted down